I would now like to turn to Major General Denis General.
Merci, Monsieur le Ministre.
Thank you, Minister.
Good afternoon. As you know, earlier this morning, Minister Anand noted that Pfizer informed us that due to work to expand one of their company manufacturing facilities, deliveries to all countries receiving Pfizer doses made at the European facility will be temporarily reduced. That includes us. I want to be very clear. This does not impact our goal to have sufficient vaccines available by end September, to all Canadians who want one. It also will not change our second quarter goals, as indicated just yesterday. Canada must still get ready for the ramp-up phase in second quarter, and that is our focus. Following this morning's announcement, Pfizer has confirmed that Canada's deliveries will be impacted for the next 4 weeks. We will see an average reduction over this time frame of 50% of expected deliveries. There will be minimal impact next week. So our shipments of next week are minimally impacted. The most profound impact will be in the week of January 25th. The allocations will then begin to scale back up in February, the first 2 weeks of February, and then return to what we expected for end February and onwards. After that, as numbers increase, Pfizer indicated that they intend to offset the impact of their production dip. In my conversation this morning with Pfizer, it was very clear that we are still correct in our planning assumption to receive approximately 4 million doses of Pfizer by 31 March for a total of 6 million doses of both approved, Health Canada approved vaccines. So we're actively engaging today with our provincial partners, and at several levels, a number of tables, including updates at the health ministers this morning. The Canadian Immunization Committee, I spoke to my counterparts in provinces and territories again this morning, just prior to coming here, to advise them of these changes to distribution forecasts for the Pfizer-BioNTech vaccine for the next month. Alors, plus tôt ce matin, le ministre Anand a noté qu'en raison des travaux d'agrandissement de l'une des installations de fabrication de l'entreprise, les livraisons à tous les pays recevant les doses de Pfizer effectuées à l'usine en Europe seront temporairement réduites. Ceci inclut le Canada. Alors, je tiens à être très clair, encore une fois, ça n'a aucun impact direct sur notre objectif d'avoir suffisamment de vaccins disponibles à la fin septembre pour tous les Canadiens qui veulent en recevoir un. Ça ne changera pas non plus nos objectifs du deuxième trimestre.
Objectives for the second quarter. As I explained yesterday, Canada will continue to prepare for the ramp-up phase during the second quarter. Further to the announcement this morning, Pfizer has confirmed that deliveries of the vaccine to Canada will be impacted for the next 4 weeks, and we will see an average reduction of 50% in the doses being delivered. There will be a minimal impact next week, but the most serious impact will be felt during the last week of January. The shipments actually will then increase gradually to be reestablished in February, the first 2 weeks, and at the end of February and March, the numbers of vaccine doses being sent to us will increase significantly. In our discussions with Pfizer, it was made clear that we are still correct in expecting about 4 million doses of Pfizer-BioNTech vaccine doses by the end of March, for a total of 6 million doses of combined of the vaccines. For February and March, there will be an increased number of vaccine doses shipped to us to compensate for the slight reduction over the next few weeks. We are in communications with the provincial and territorial counterparts. A couple of hours ago, I also spoke with certain counterparts and also the testing and screening expert advisory panels to advise them of what will be happening over the next month. And I also had the opportunity to discuss with my counterparts at the provincial territorial levels. We continue to work to try to give as much notice as possible for clarity on the days for distribution, the quantities available, And specifically, we're discussing what the impacts of this reduction from Pfizer with our provincial and territorial counterparts. Thank you very much, and I'll pass it back to the minister. Thank you. Patty, please go ahead.
I think I heard you say, go ahead, Minister LeBlanc. Okay, thank you. I was just remembering to put my headphone on so I could help with the translators. Thanks very much for your patience. Thank you very much, Major General Danny Fortin, for your hard work and your consistency. I think all Canadians are grateful to have you, especially during this very difficult time. And the time is indeed difficult. This morning, Dr. Tam and Dr. New were extremely clear. The coming months are hard, and we need to keep doing everything we can to slow the spread of the virus. And this means that as Canadians, we need to think carefully about the choices that we're making. Every decision that we make matters. More Canadians are receiving the vaccines every day, but this doesn't mean that we can stop following the public health measures that are protecting us all. I do want to thank all of the Canadians who have chosen to cancel travel plans and who continue to make sacrifices to help slow the spread of the virus. Please keep asking yourself, do I absolutely need to go out today? Can I reduce the number of times that I am going out? Can I purchase the things that I need online and have them delivered to my home? Is my travel absolutely essential? These are the kinds of questions that reflect just how serious the situation is. And there are also ways that we can be part of reducing the spread in our own communities. Now, you've heard us say it over and over, our government will do what it takes to protect Canadians for as long as it takes. And earlier today, I spoke with provincial and territorial health ministers, and we spoke about the vaccination across the country, the new development on the number of doses that Canada will be receiving. I assured the provinces and territories that we would continually update them in the coming hours and weeks on the adjustment to the immediate deliveries of Pfizer vaccines and delivery schedules as they become available. And of course, the diversity of Canada's vaccine portfolio was built to account for challenges with any of the vaccine candidates. All health ministers committed to working closely together in a spirit of collaboration to vaccinate Canadians fairly and as quickly as possible. We also discussed new advice provided by experts on how to adjust testing strategies across the country and help make sure that all Canadians who need to be tested are able to get one. I encourage you to keep thinking about whether or not a COVID-19 test is right for you, if you're symptomatic, if you're worried about being exposed, if you have symptoms that you're concerned about, please call your local public health unit and ask if it is appropriate that you get a test. We do need to keep pulling together to fight this virus. One thing we've learned about this virus is that it preys on individualism and that it's collective action that protects us all. So in that regard, please keep reaching out to the vulnerable people in your communities. People are lonely and scared, and we can be part of the solution by giving them a call, dropping them a note, shooting a text. And don't forget that there's many resources that you can use for support for mental health or substance use, like the wellnesstogether.ca portal that can help connect you or your loved ones to supports instantly. And finally, I'll just say about Wellness Together, it's available in both official languages and translated into dozens more. So please don't hesitate to check out that resource and certainly support any of your friends or your family if they are struggling. Thank you very much.
Merci beaucoup, Patty. Alors, c'est à vous.
Thank you very much, Patty. Jean-Yves, over to you. Thank you, Dominique, and hello, everybody. I'd like to take this opportunity to summarize some of what the Prime Minister Trudeau said this morning. We all know that the situation is very serious everywhere in the country, but particularly in Quebec. That's why in Quebec, we must continue to follow public health measures, including the curfew. It's not easy and it's not enjoyable, of course, but it is absolutely necessary to reduce the pressure put on our public health services and our health workers. As Minister Haidu stated, we also should not hesitate to get tested In Quebec, we have a very high rate of positive tests, and we need to not hesitate to get tested if we think that we have the symptoms that fit or if we have been in contact with somebody who has contracted COVID-19. Prime Minister Trudeau also reminded all of us that this is a cooperative and collaborative effort between different orders of government. There are tens of thousands of rapid test kits that have been provided to the provinces and distributed, and that can make a difference in Quebec as well. And in Quebec, we need to highlight that there are $40 million that has been sent to organizations working to reduce homelessness. I know that in my riding and throughout Quebec, it is essential to be able to have our own housing, to be able to protect ourselves and recover. There is also information, as we've heard, regarding the reduction in Pfizer out of Europe. This week, however, we saw 380,000 additional doses being provided to the provinces and territories. This is, in 1 week, nearly double the number of doses that the provinces and territories will be able to administer over the next few weeks. By the end of March, despite the short-term hiccups that we may have seen, there are 500,000 doses of the vaccine that will be delivered. 6 million doses, as Major General Fortin was saying, by the end of March. The long-term objective is still the same, to be able to vaccinate all Canadians who wish to be vaccinated by September. Thank you, Dominic. Thank you, Jean-Yves. Now we'll be pleased to take your questions. Thank you, and we will continue. We will start the question period over the phone lines. 3 questions. 1 follow-up question, and then we'll return to the room. Operator, over to you.
Merci. La première question est de. The first question is from Catherine Lévesque de la Presse canadienne.
Catherine Lévesque, Presse canadienne. Question. Yes, hello, everyone. Major General Fortin, my first question is for you. You indicated that the impact will be minimal next week and that it will be more felt the week after that. Could you give us some numbers that we are getting in Canada over the next 4 weeks? Do you have those numbers on hand? Answer. Yes, certainly. We are currently working on the distribution timeframes for the BioNTech Pfizer vaccine. We're making those adjustments today, and we'll be sharing it with our provincial counterparts soon. The impact will not be felt too strongly next week, simply because our order for next week was not too many, but the significant impact, so that means we'll see about a quarter of what we were hoping to receive in 2 weeks. A principle that is being adhered to by Pfizer is fairness. So all of their clients are being impacted. All of those who are receiving doses from their year facilities are seeing their doses cut by half, about. So we won't see too many impacts next week compared to other countries, but we'll see it during the second week. And then things will move up from then. After that second week, it'll be half the doses we're expecting, and then 2/3 for the first and second weeks of February, respectively. And then after that, the number of doses coming in will increase significantly. It's important to remember that the manufacturer is committed to supplying the doses it has promised us. We're looking at 40,000 doses, or 40 million doses rather, for 2021. It'll hurt in the short term, but things will improve significantly by the end of February. I believe the manufacturer, following my discussions with them, know that my colleagues at Procurement Canada had similar discussions with the manufacturer. The impacts will be felt now. There are a number of factors, a number of options to be considered by the manufacturer. This is what they went ahead with, which will hurt at the beginning, yes, at the beginning of the production, but that will allow them to ramp up their production significantly later on. Thank you very much.
The next question is to Minister Hajdu. I'll just ask it in English. We just reached out to the Quebec government about the second dose, and they say that the announcement by Pfizer today is just reinforcing the fact that they should be delaying the second dose to up to 90 days. So they're saying with the announcement today, it's just the best decision in the circumstances because they want to vaccinate as many people as possible. So I was wondering, what's your reaction to that and right way to go in the circumstances for Quebec? Thanks.
Thank you, and I appreciate the question. Our position remains the same, that doses should be administered as closely as possible, adhering to the manufacturer's requirements. And there is new national guidance from NACI, the National Advisory Committee on Immunization, that suggests that doses could be extended up to 42 days. But ideally, compliance with the guidance and the science and the evidence is the best approach. Having said that, obviously the provinces and territories are making decisions based on their best evidence and their knowledge of the delivery schedules. And we encourage all provinces and territories to adhere as closely as possible to the Health Canada guidance that evolves as the NACI recommendations do.
Merci. Prochaine question.
Thank you. Next question.
Thank you. La prochaine question est de. The next question is from Christy Kirkup from the Globe and Mail. Please go ahead. À vous la parole.
Hello, good afternoon. My question is also for Minister Hajdu. I just would like to ask, drug makers, including Pfizer, have said that access to COVID-19 vaccines came up in discussions with your government about new regulations to reduce drug prices. And I'm wondering, did Pfizer, Moderna, or any vaccine producers threaten to withhold COVID-19 vaccines from Canada if the new regulations came through?
Not in my conversations, and to be clear, I've had very few of them with the manufacturers. In fact, Minister Anand, in her role as the procurement minister, has the most direct relationships with the manufacturers. But in my conversations, the conversation has been really focused on Canada and Canada's procurement of vaccines.
And just as a follow-up, Minister, this is a 6-month delay to the PMPRB. This is an additional delay. These changes were actually being looked at some 5 years ago now. What is the impact of this additional delay?
Well, listen, our government's done more than any government in a decade to lower the prices of pharmaceuticals and drugs in Canada. We continue to aggressively work on the cost of drugs and on a national pharmacare plan. And in fact, have been, working on standing up the Canada Drug Agency and a number of other measures that lay the foundation for a national universal pharmacare program. The PMPRB is a component of that, but certainly we understand that during a pandemic, it is very difficult for consultations to continue, for changes to be made, and of course, for pharmaceutical companies that are right now very focused on research development and the provision of essential medicines and vaccines. And so in the spirit of fairness, we're working collaboratively with the industry to make sure that they understand our intent is to proceed on lowering drug costs and making sure that Canadians have medication, but through a spirit of reasonableness.
Merci, thank you. Next question, prochaine question.
La prochaine question est de. The next question is from Émilie Bergeron de Agence QMI. Please go ahead, à vous la parole.
Question. Yes, my question is regarding how to deal with the delays from Pfizer. Are you looking at increasing the doses we'll be getting from Moderna to to compensate? Answer, if you'll allow me, and then I'll let Major General Fortin give you details on the more specific details of delivery and distribution of the Moderna vaccine. First, I'd like to say that we have solid agreements with both pharmaceutical companies, including Moderna. My colleague, Minister Anand, is working every day to see whether it is possible to have more doses delivered more quickly so that we can proceed with our vaccination program. In terms of our relationship with these companies, we have excellent relations, an excellent reputation and ability to work with them, but I will defer to Major General Fortin regarding the rollout schedule of the Moderna vaccine. Answer. Thank you, Minister. Quantities continue. The number of quantities continue to fluctuate while companies are adjusting their production lines. Moderna is telling us quite confidently that they will be sending us 230,000 doses. They promised us in mid-February. We're expecting for 250,000 during this. Moderna is delivering their vaccines every 3 weeks. We are expecting 1.2 million about for the month of March. The exact distribution dates are always being finalized. Moderna is working very hard to give us as much prediction as possible as to the number and timeline for the doses that we'll be getting for the month of March. We're always working with the number of 2 million for this quarter. Of course, during our discussions, we're always trying to see if anything can be done to provide more doses sooner. But for the time being, this is what we're expecting from Moderna, that is 2 million doses. Question. You mentioned a number of times that in February, the number of doses delivered will increase to be quite quick, in fact, at the end of February. Do you have an idea of the scale, the proportion by which deliveries will be increased? I imagine that this is what is allowing you to feel confident that you will be getting those 6 million doses in total from both companies. Answer. Yes, this is Major General Fortin. We are still working out the details of the impact from what we heard today. The exact distribution schedule will be confirmed over the next few days. Now, for the next few weeks, we expect to be getting the doses we had already planned for. We had talked about 367,000 doses for the month of February. So we expect those numbers to be reached again in February. We'll just wait to see what will happen during the month of March. But as I stated, we expect Pfizer to reach the 4 million doses during this quarter. So there will be an increase in March, but we don't have the exact numbers. As soon as we have more information, we will inform our partners, and we will be able to share that information with the media as well. Answer from Minister Duclos. Madame Bergeron. Ms. Bergeron, I can perhaps add a few numbers that you were looking for. Over the past few weeks, we delivered about 200,000 doses per week to our provincial and territorial partners. And by the end of February and March, it will be 500,000 doses. So you can see that there's a ramp up. There will be a ramp up, and Major General Fortin is being quite clear in terms of the short term, based on what we heard over the past few weeks. But we'll be moving from 200,000 per week to 500,000 doses per week on average by the end of March. Thank you.
To the room for questions. Nous allons venir dans la salle pour les questions. Première question.
Hi, Rachel Haynes here from CTV National News. My question is for Major General Fortin. And perhaps also Minister LeBlanc. It's about the provinces. And earlier this week, the provinces were talking about the lack of supply and how they were pushing the federal government for more doses of the vaccine. And in response, the answer was often, well, look, we have this delivery schedule and the provinces can be assured of that. However, today we're finding out that, the delivery schedule may not be as reliable as it has been before. So how can provinces reliably plan their own vaccine rollout if the schedule keeps changing and they still don't know how many vaccines they're going to be receiving each week coming up?
Perhaps it's Dominic LeBlanc. Perhaps I can answer a part of that question, and if my colleagues have precisions to add, of course they will. We have been very transparent with provinces and territories and with Canadians from the beginning of the conversation around mass vaccination campaigns that there can be and likely would be from time to time some challenges around global supply chains, around biomanufacturing capacities globally. So in all of the planning discussions that I've partaken in with provincial ministers, provincial premiers, we have always shared with them the concern that this kind of information is not unexpected. Our challenge is to ensure that we have redundancies, that we have a number of vaccine candidates, that we accelerate, obviously, as much as possible, the deliveries of, in this case, Moderna. We expect potentially other vaccines to be approved, we hope, over the coming weeks and months. So the picture will change dramatically in a positive direction as we go week by week and month by month forward. But we also understand the urgency that Canadians feel and that provinces feel that as quickly as possible, we can get as many approved vaccines as possible into Canada, and obviously in an effective, secure way, as we have done from the beginning, transfer those to provincial authorities for their immunization campaign. So General Fortin and his team have been working with their provincial and territorial counterparts from November and December in order to prepare for these contingencies, to plan week by week as best as we get the information from manufacturers, how provinces can properly ramp up and scale up their administration. So this is work we're going to continue to do. It's a global challenge. There are many other countries that will be affected by these challenges in the weeks going ahead. But that's why Canada is in such a good position, we believe, by having such a diversified and exhaustive portfolio of potential vaccine candidates. So we have built into the system these shock absorbers to ensure that we can meet the commitment we made to provinces and territories that all Canadians who want to be vaccinated can be vaccinated by the end of September. And as General Fortin said, we believe that the reduction in numbers in 2 and 3 weeks from now, for example, can be caught up in the subsequent weeks of March. So our hope and our plan is to also maintain the schedule we had for the period from January 1st to March 31st. But perhaps my colleagues want to add something.
I'll just add, Dominic, that at the health ministers' table today, the health ministers again reiterated their commitment to working collaboratively together, fully understand that this is a very competitive environment where vaccines are obviously in demand around the world, and that manufacturers are trying their best to scale up their procedures to manufacture vast quantities of vaccine for the world, and recommitted to doing the work that will put us in good stead, I believe, when we start to see increased deliveries in the end of Q1, Q2. And so I have to say that I'm very impressed by my ministerial colleagues' efforts to scale up their capacity to vaccinate and to vaccinate in all kinds of different settings that can be quite challenging.
Follow-up?
And just going back then, perhaps Major General Fortin, this is for you about the catching up. So if we are going to be seeing the reduction coming up in January and February, how is each, let's say the quarter reduction that we're going to see, that'll be added in March? And if you can give a little bit more about that delivery schedule. And also, have we received guarantees from Pfizer that this is going to be the only time that we're going to see this slowing down of production, or have they not been able to make that guarantee?
So look, I understand the disappointment today. I share the disappointment, but we need to move forward. And my message is this: 4 million doses of Pfizer BioNTech product between this quarter. So by end of March is still our target. That's very much what Pfizer intends to do. And if you do the math in public, you have a significant drop in 2 weeks. Yes, it'll pick right back up in March, in February and March. What those numbers are exactly, I don't know, but the allocation forecasts will continue to fluctuate. This is a bump in the road, and we'll continue to cruise forward after that. But I would say Pfizer manufacturers everywhere at all levels, we would like to have more predictability, assurances that the plan will unfold as we wish it to be. But there's a global demand of unprecedented proportion, as Mr. Aju mentioned earlier, and it's they're all manufacturers are I trust are doing their very best to deal with all those things as effectively as possible. As Pfizer shared with us this morning, they contemplated a number of different options. They took the option that best that provides the scale up, the best scale up possible over the next months, and they'll produce in mass very shortly.
Thank you. Next question.
Hi, David Thurton, CBC News. Major General Fortin, how much heads up were you given that Pfizer was going to be doing these upgrades? It seems like this is something that, they could have provided us with an indication of this months, maybe even weeks ago. How much of a heads up were you given?
Well, we knew that they wanted and they needed to upgrade, scale up their production line in Europe. What that meant and when that was going to impact, if it was going to impact the production and the shipments to Canada, that was unknown. And they, as I said, they contemplated a number of different options. They made the decision. Pfizer made the decision to take the option that they took, and we shared. We learned the news early this morning, and we shared that through the various tables to all our partners today.
I mean, do you not have? Is the question not occurring in your mind? You were just before the national audience, before Canada yesterday, saying that we're going to get 208,000 doses throughout the whole of January from Pfizer. It would have been nice before you made that announcement to have been given that information ahead of time, or a hint that this might be, in the works.
Well, I'm never going to lie to Canadians. So the numbers that I shared yesterday were the numbers as we knew them, as we all knew them. What we did know is that there were fluctuations to the productions moving forward. We still did not know what the numbers would be for March. We still do not know what Moderna numbers would be for March, but we are working on targets based on shared understanding of what we expect to have produced in those facilities. So of course, the numbers that we had yesterday were correct. I want to go back to, although this is a disappointment and this is a drop in numbers for the short term, we'll have long-term gains collectively, and we'll have significant increase in numbers in February and March. I expect to be back here and share clarity on numbers moving forward as we have them, as we're able to share them with Canadians, and respectful of our engagements, contractual engagements with the manufacturers.
If I may add very quickly two aspects of this fundamental level of transparency and collaboration, which Major General and his team, with of course Minister Anand and Minister Haidu's team, have been displaying over the last few weeks. Everything is public for many days. Minister Anand and Haidu and Major General Fortin had been posting on the websites the deadline, the sizes, and the various aspects of deliveries of both Moderna and Pfizer to provinces and territories. Just last night, our colleague, Minister Anand, learned about this issue, and this morning, just a few hours later, Minister Hajdu was already talking with her colleagues in provinces and territories to make sure that they had all of the available information to proceed with the important and difficult work that they need to do to administer the vaccines that we are able to deliver to them.
Merci, thank you. Next question.
Hello, Major General Fortin. This is Mal Hamidi with the Canadian Press. You said that the impact of the Pfizer news is going to happen in the next 4 weeks. We are expecting sort of a drop, and then the numbers will pick up later in February. Can you more clear on the, like how the news is going to impact the shipments in the next 2 weeks and in the later in early February?
So the impact in the shipments, impact for next week, minimal. We will feel it more in the following week, as I indicated earlier. We'll have about a quarter of what we expected that week. Numbers will pick right back up after that to about half of what we had expected. Significantly and progressively grow into the rest of February. Pfizer is telling us it will impact us for 4 weeks. Every country that gets their Pfizer product from the manufacturer in Europe are impacted and see their quantities cut by half. I don't know what that represents for the manufacturer and the changes to line of production line, but that's all they can produce. So everybody gets affected equally. We're not affected as much initially just because our shipment was being prepared for transport. So it will impact us more in the second week, and then it'll be more progressively. They'll progressively add to that to those quantities.
My next question is for you and for Minister Hajdu, maybe. She wants to comment, is about the data and the information you're receiving from provinces on their administration of vaccines. Are you receiving enough data to maybe, update or change your plans or shipments plans in this regard? And do you believe, Minister Hajdu, that there should be a vaccination passport system that would help maybe in administering the vaccine during the next months?
Your mic is
Patty,
on mute.
You're on mute, I think, Patty.
Thank you. Thanks for the question, and I'll start and then pass it over to Major General Fortin for some details about the relationships that he has and the work that he's doing with the provinces and territories. Absolutely right. Data is very important, and understanding how vaccination is unfolding across the country in provinces and territories is important, as well as tracking any unintended consequences of vaccination, any adverse events, for example, the research on immunization and the role it plays in onward transmission of the disease is an important understanding. And so the provinces and territories are working really closely with the federal government, providing that data. And as you know, we've recently contracted for the creation of an additional tool that will help bring into cohesion how we manage data about vaccination across the country. I'll just say this, I think everyone is interested in ensuring that we have really good, strong data, not just about coverage of vaccines, as I said, but the impact of vaccines and the impact of vaccines on the disease spread. And so we continue to work very collaboratively with provinces on that. I think you've heard the Prime Minister respond about a national vaccine passport. There are many questions about that, what that would mean and look like. I'll just say this, vaccination in general is not mandatory in this country for a whole host of infectious diseases, but it is compulsory to attend, for example, school in most provinces. Children must be vaccinated against childhood illnesses or have a reasonable a reason why not. Sometimes immune compromised individuals, etc. There are workplaces that require proof of vaccination in order to be able to work in a healthcare setting, for example, or certain rules for other kinds of workers that are in other sensitive positions that require vaccination. This is a very live conversation, as you know, around the world in terms of how to deal with vaccination for international travel. And Canada's in those conversations. I know the Minister of Transport has been involved in those conversations, many of my other colleagues, and we'll continue to look at what the implications are from an international travel perspective. But I think at the end of the day, Canadians have deep interest in becoming vaccinated, both to protect themselves and to protect their communities.
Just to add to answer to the ongoing coordination with our provincial and territorial partners, next week we'll have we'll get together on a conference call and discuss planning assumptions and option space for the next quarter. So that 20 million doses of both Moderna and Pfizer, what does that look like in your province, in your jurisdiction? And look to share best practices, identify the different health workforce mechanisms that we can together work on to grow, to scale up in the next quarter. And we'll have follow-on discussions about that and how we get to, as new vaccines become approved, how do we roll them out? How different is that from the current vaccines, and so on and so forth. So there's a lot, there are daily conversations with provinces and territories, and we'll continue to have that and pull those players at the right level in those discussions that keep moving things forward. This is in addition to the ongoing tables that you know of, CIC and NACI. So that will also continue to be forum of discussion where we can all learn about the best ways to roll out these vaccines.
Merci, thank you. We will go back to the phone for some additional questions. Opérateur, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Tonda McCharles from the Toronto Star. Please go ahead, à vous la parole.
Hi, General Fortin. Can you tell me if Pfizer is expanding their production line, did you ask and did they offer then to actually increase Canada's delivery of product? Why are you settling, in other words, when they're ramping up and they've expanded their production capability, why are you settling for the same 6 million by the end of March?
So I am not having those discussions with Pfizer. I'm very much about coordinating the shipment and the distribution in country of those vaccines that were acquired and the quantities that we are aware of. Our PSPC colleagues work very hard on the next quarters, confirming those shipments, confirming those contractual obligations, and move forward. And of course, they continue to investigate other vaccines as they become approved and available. How much and when can we bring that in the country?
So just so I understand, if I understand what you just said, then you're not aware if Canada, through Minister Anand's office, asked for any increase once Pfizer's in a bigger production capacity line. But my next question is exactly on what you just mentioned, the other two vaccines. Is there anyone there that can give us a line of sight on how soon Canada's regulators will be in a position to make a decision on AstraZeneca or the Janssen vaccine?
Thanks, Tonda. It's Patty Hajdu. I will say on item one about the negotiations with Pfizer, I will tell you that Minister Anand and her team are in constant negotiations with the vaccine manufacturers about earlier doses and more doses. Those conversations happen on a regular basis, and I know that they are leaving no stone unturned. And if those conversations result in additional capacity for the manufacturer to provide Canadians additional doses, then I know that we are well. And on question part 2 of your question around the progress of AstraZeneca and Johnson & Johnson, as you know, both of those vaccines are with Health Canada right now for the regulatory review. Things are proceeding well. The companies are working well with the regulators. There is a lot of back and forth on the data, and we're well aligned to be able to make decisions in the near future on AstraZeneca. On Johnson & Johnson, it's a little bit further out.
Can you be more precise on your future?
I can't, because it depends on the nature of the data being submitted.
Thank you. Merci. Nous allons prendre la prochaine question. Opérateur.
Thank you. Merci. The next question is from, la prochaine question est de Christian Noël de Radio-Canada. Please go ahead. À vous la parole.
Christian Noël, Radio-Canada. Question. Hello. My first question is for Ministers Duclos and Leblanc. We're saying that because Pfizer is reducing its production, there'll be an impact. You're saying that it will hurt. How will it hurt specifically for the provinces and for Canadians? Well, answer. This is Dominique Leblanc. If you'll allow me, I'll start, and perhaps Jean-Yves can add something. As we have been saying from the beginning, there are uncertainties in terms of global supply chains for these pharmaceuticals. From the very beginning of our discussions with the provinces and territories, we have shared what the reality is of the situation, that there may be adjustments. However, we understand and we share the feeling of urgency to try to vaccinate as many people as possible and as many Canadians as possible, as quickly as possible. This is still our objective, and it will lead us to success undoubtedly with the provinces and territories over the next weeks and months. This is a reduction over 2 to 3 weeks, but as Major General Fortin explained very clearly, after that in March, we expect that we will be getting additional doses to fill that backlog, and then we'll be back up and running. This is something that we have provided for in the planning. It is not a surprise. Pfizer assures us that they will provide the doses that were planned for January, February, and March. As my colleagues have clearly explained, that's why we are not depending on one company only. Moderna will also be delivering vaccines over the next few weeks, and it will increase significantly, those numbers, that is, in April as well. Minister Hajdu just stated that other candidates may be approved by Health Canada officials that would give us even more options to vaccinate as many Canadians as possible, as quickly as possible. Jean-Yves, do you have anything to add? Answer by Jean-Yves Duclos. Yes, well, you said it very clearly. This is something that is completely beyond our control. It has nothing to do with the Canadian government's or the province's abilities to change anything to this situation. It is an issue with the European manufacturing capabilities. We have excellent relations with these producers. We are the second country to have approved in the West, to have approved these vaccines since after the UK, since the beginning. We have done excellent work. We are at the head of the race here. Over the past few weeks, we received about 200,000 doses per week. It started sooner than we had dared hope, and until the end of March, we will be getting an average of 500,000 doses, which we will be able to provide to the provinces and territories. So, as the Major General stated, even if there are bumps on the road, we have been working hard for many weeks now, and we'll continue to work hard. As we announced a few days earlier, we'll try to get even more doses for Canadians. Question. Thank you. Yes, I'm not quite sure if I got a clear answer to my question of how it will impact Canadians and Quebecers. This is for Major General Fortin. What kind of threat that you're aware of were made or existed against facilities, both for manufacturing and for storing the vaccines in Canada? Answer. Well, there are a number of threats, types of threats that are always monitored, whether it's in cyberspace or misinformation efforts or unsolicited offers to sell us vaccines. Our various security partners are constantly monitoring these threats. When we are alerted to possible activity of any kind that could impact the delivery of vaccines, the RCMP and other security and safety partners look at those threats, and law enforcement make sure they carry out their duties to ensure our security. I can't really get into any more detail than that.
We will take a final question in the room.
Major General Fortin, I thought I would ask you, Pfizer also has production capabilities in the United States. Did you ask Pfizer about that? Is there any way that those facilities could help make up for the shortfall? What about that?
Ministers might want to chime in, but I would say we have those constant discussions with the manufacturer as to meeting their objectives. 4 million of Pfizer in this quarter, and then the remainder of the 40 million in the coming months. They're a global manufacturer. Right now, our product comes from Europe. There's no indication to the contrary, and they manage those production lines internal. So that's really all I can say right now. But our product comes from Europe.
I'll just reiterate that Minister Anand leaves no stone unturned with her procurement team to secure doses from all of the vaccine producers, and has regular conversations about accelerated doses, additional doses, and the potential of obviously doses from other manufacturing sites. I will also just point out that Health Canada, as part of the regulatory approval, approves the manufacturing sites as well as the vaccine itself. So should we procure from even the same company, a different site, then there would need to be a review of the manufacturing data. But having said that, I know that she is working with Pfizer and with all of the vaccine companies on a regular basis to make Canada's position clear and to make sure that the companies are doing their absolute best by Canada.
Parfait, merci.
Perfect, thank you.
To today's press conference. This was an end to today's press conference. Have a great day.